And one of the topics that I commonly see, especially with overhead lifting, is how high someone's arm can actually get up over their head in order to perform a thing with a barbell, such as a snatch or an overhead press. Common things that I'll see in my office is the lack of rotation in the glenohumeral joint. But if their goal is to be able to lift into that overhead position, a drill that I like to give them if they're qualified for it is an overhead pails and rails to expand range of motion. And what that looks like is we utilize a band. We can do it unilaterally or we can do it with both. If they have one arm that's moving freely, great. If they have one that's not, then we tend to do it unilaterally. So they hinge back into this position where it kind of mimics an overhead. They find themselves in a stretch where they feel it on the underside. Once that stretch time is up, they are coached into creating abdominal pressure, creating tension everywhere. They're going to take a little breath, and then they're going to slowly start pushing down into the band to contract the underside here. Then they allow the band to pull them up, but they guide the band to go up to contract the top side, reach, and lift. Now the band gets light, and I'm going to use the back side of my body to lift me into this position. Hold that for 10 seconds, and then I'm going to drop my body down to allow my arm to be in a deeper stretch. They're going to rinse, repeat, recycle this stretch, downward contraction, upward contraction, 2 to 3 times for about 6 to 8 weeks to actually see the changes that they're looking for.